Good morning, everyone. Welcome back to our September series entitled Life After Retirement. I'm Dr. Lazarus, clinical psychologist with Amicus Medical Centers, servicing Broward, Palm Beach, and Martin counties. Hopefully you enjoyed the first week's kickoff and will continue to add information and strategies to your toolbox of coping during what can be a stressful time in a person's life. So this week, actually in the month of September, is Suicide Prevention Week. And as you'll see, the whole month is tailored towards certain topics of how people adjust and cope and resources to help facilitate a healthy and promising transition into life after retirement. One of the most important aspects of the month is during this week to address suicide prevention. So I'm going to start with a couple statistics. This is from the CDC. Just gonna give you a couple things that you may find surprising and hopefully will remind everyone the importance of noticing in ourselves and in others some risk factors. So according to the CDC, suicide is a leading cause of death in the United States. In 2019, it was responsible for more than 47,500 deaths. In 2019 also, 12 million American adults seriously thought about suicide. 3.5 million made a planned suicide attempt, and 1.4 million attempted suicide. There are risk factors that can increase one's chances for thinking about suicide and making an attempt. Those who have experienced violence, trauma, any kind of abuse, bullying, etc., are at higher risk for suicide. Now, the last statistic I want to go over, interestingly enough, in early 2020, right as the pandemic was hitting, there was some data that suggested, according to the CDC, that a 4.6 decrease in suicide deaths during the COVID-19 pandemic during the year of 2020. However, the pandemic has increased risk factors for emotional distress, so as well as risk factors for suicide, which included social isolation and barriers to physical and mental health care. So while the rates of successful or completed suicide decreased during the 2020 year, there was an increase of risk factors associated with suicide. And so I wanted to start with the statistics because it's everyone's concern. It's your concern, it's your neighbor's concern, friend, coworker, etc. And it's important for us to be on alert and learn what the risk factors and thoughts are that could be associated with it so that you can better identify it in yourself and seek help, or identify it in someone else and get them the help that they need. So some of these risk factors or warning signs, include being isolated, increased anxiety, feeling trapped or in unbearable pain, substance use or continued abuse, taking steps to acquire things needed to help facilitate a planned suicide, increased anger or rage, mood swings, extreme depression or hopelessness, sleep difficulty, either sleeping too much or not sleeping enough, thoughts or speaking about death and dying, and then making plans for the suicide attempt. That's not in any way an exhaustive list of risk factors, but does give the main areas that you would want to look at both within yourself and others, to be aware that you're struggling or your friend or neighbor is struggling and to seek help. Another important aspect is to understand your emotions. So I've listed a whole list of risk factors, including anxiety, depression, some behavioral changes, etc. The key to suicide prevention, one of the keys, is to understand what it is that you're feeling. Maybe assess any triggers or catalysts for bringing about the feeling, if it's something that's new, if it's something that's been ongoing or continued emotion from, let's say, 5 or 10 years before, recognizing that perhaps that feeling or situation is unresolved, and resolving it can ameliorate the distress that it's currently causing. So it is important for you to understand what exactly is it that you're feeling. What is the cause? What is the situation? Is there a way to address it? If it's a situational aspect, let's say the pandemic. So as I mentioned, during the pandemic, the completed suicide rates decreased, but there was an increase in other emotional distress components, such as being isolated. So for example, a person who's feeling isolated would reflect in order to understand what that isolation, what's causing it, what's maintaining it, and how to maybe take steps to ameliorate it. So let's say it's the pandemic that caused the person, they're no longer working outside the home anymore. Most people were quarantining or isolating, and so that feeling of isolation and loneliness is what's bringing about the thoughts of suicide. There are problem-solving strategies to perhaps address that. Now, understandingly, the situation may not be ideal, and the solution that you think of wouldn't be your preferred solution or ideal, but something can be better than nothing. So for example, hopping online and joining an online Zoom group, talking about a topic that you're interested in, engaging with others online. Again, not ideal, but is a way to feel connectedness towards other people. And so when you're understanding what the cause of the emotion is, we can explore logical and rational ways to solve that so that we feel a little bit better, knowing that it may not be our preferred solution and it may not be the ideal solution, but it is a solution that can help us feel better. That's an example of how you would understand your emotions. If you're doing the reflective work on your own, and it can work with any emotion, you would reflect and explore when it started, the cause of it, solutions, anywhere from the most ideal solution to the most unhelpful solution, and then pick. And you may have to go through all of them, but that is one way to better understand what your emotions are. Now, if after you've done that work, if you're still experiencing suicidal thoughts that are either scaring you or you know that you're going to act on it, the second best thing that you can do is to create a safety plan. You can do this alone, or you can invite those who are close to you into the plan. But a safety plan would look something like getting out a piece of paper and writing down actions that you can take to prevent yourself from acting on the thought. That might mean staying at a neighbor's, friend's, or family member's house. Again, that may not be the most ideal solution, but it's the safest for you. So you would write all of the plan out. Seeking support, calling a friend, family member, therapist, reaching out for connectedness if it's loneliness, having the phone numbers for help. So the National Suicide Prevention number will be and should be flashing below me. It's a national number. The 3 counties also have local numbers that are also going to be listed throughout the presentation. But the phone numbers would also go in your safety plan. So it's a plan to be able to pull out when you're scared that you're having the thoughts or when you're about to act. Some may say, well, you know, it's going to be challenging to pull out a piece of paper if the action is so strong. And it can be difficult, but that's where the importance of a safety plan comes into play. So you want to think about what your course of action will be. Similar to buildings that have the fire escape routes posted throughout the hallways, so that should there be an emergency, people know where to go. Your safety plan is your blueprint of where to go and what to do when the thoughts arise. And again, it can have concrete steps such as calling a friend, going to a friend's house, not being alone, calling your therapist, to other cognitive behavioral strategies to help. So understanding your emotion, reframing your thoughts, etc. So I would encourage all of you to create a safety plan, and you pull it out, use it when you need to. One of the most important things would be to know when to reach out for help and how to get help. So as I mentioned, the National Suicide Prevention number is going to be flashing on the bottom. The counties also have local numbers. Reaching out for help and support is never a bad thing. Meeting with someone professional like myself or someone else can always help process and make you feel like you're being heard and help you through whatever it is that's causing the thoughts. So always ask for help. If you don't know where to go, that's where the phone numbers are for. You can also call Amicus. The Amicus phone number is also listed on the bottom of the presentation. If you're seeing suicidal ideation in someone else, same steps apply. If you're not a mental health professional, you can still take steps to create a safety plan with them in order to keep them safe until they get the professional help that they need. Reaching out is going to be the hardest part for some. And so that's why we try to make it easy for you. The phone numbers are here. It's all anonymous. There are times when, for your safety, others may need to become involved, but for those who are able to process and want help, it never hurts to reach out. You can always reach out to me. The phone number is on the bottom. More than happy to help you. As I mentioned, the National Suicide Prevention phone number is also going to be listed on the bottom. I do hope you found this helpful. And if you have any questions or concerns or want to talk more about it, please don't hesitate to give Amicus a call. I'll see everyone next week when we continue our series. Stay safe, everyone, and be well.